This is about WikiJournal of medicine. I'm not sure whether you are aware that there's a academic journal being developed on the Wikimedia platform. WikiJournal of medicine is the flagship journal, and subsequently other journals have come up, will possibly come up further subsequently. So we have at the moment WikiJournal of medicine, WikiJournal of science, WikiJournal of humanities, and WikiJournal preprints. The main feature of this journal is it is Wikipedia integrated. It's open access license which is free for the authors to publish in and free for the readers to read. It's a peer-reviewed journal. The peer review is public, so you have the benefits, and most importantly, you have the wiki advantages. So anything we do goes online immediately. There's no lag between what we do and making it available. This is under the WikiJournal user group, which mediates whatever has to be done. And as you understand, this is a new form of academic publishing. WikiJournals are a new concept in open access publication. They consist of independent open access peer-reviewed journals with no publication cost to authors. They are hosted on Wikiversity by the Wikimedia Foundation, the same body which hosts Wikipedia, something we all know about. Now about Wikipedia, the level of accuracy is, I'll shorten up as good, but it's not considered to be a reliable source. So ultimately, this journal bridges the gap. WikiJournals use the uncommon diamond open access system, which makes it available in a way that neither the author nor the user has to pay anything. It has been started in 2014 and attracts reference text images by the means of scientific publication, which can be used across Wikimedia projects. Apart from review articles, original research can be published in WikiJournals. This is the difference from the Wikipedia. And also accepts articles that are notable in their own right. So, is it useful? Criticism of Wikipedia includes claims that it exhibits systemic bias, presents a mixture of truth, half-truths, and some falsehoods. Perceived no guarantee of validity for its content due to its open structure. Ensuring Wikipedia standards of notability and lack of accountability resulting from users' anonymity. The changes are reviewed but not systematically, and possibility of vandalism. The biggest issue on Wikipedia is the lack of information, and that it cannot incorporate original research. Furthermore, researchers want credit for the work, and particularly there is a shortage of images. So, WikiJournal of medicine and the other WikiJournals come in here. So, how does it work? Now, academic journals have their articles peer-reviewed. There's a factor of reliability, quality check, elimination of bias, and citable version of the record. We have all those in WikiJournals. Now, there's a big issue that academic journals have to face. That is the maintenance costs, journal subscription, advertising, paywall, and for the ones which are not paywalled, the APC charges and article processing charges. Furthermore, images there are copyrighted. We overcome those in WikiJournals. And as you understand, we can publish original research, case studies, reviews which can be focused, encyclopedic, or even images. There's a discussion about videos being published on WikiJournal, but as James has already pointed out, there are issues. Now, our journal has best practices. They are compliant with ICMJE recommendations, Budapest Open Access Initiative, and is a member of COPE. It has a ISSN. It has DOI codes assigned to each of the articles and can be tracked. They have altmetrics ID incorporated, and the journal is listed on DOAJ. It's also indexed on Informat and Science Open. And after we complete a certain threshold, we hope it will be enlisted on PubMed as well. We have plans for going into Web of Science. It's in process. So the after submission of work, it's peer reviewed. The editorial board takes a decision whether to publish, and finally the publication is done. But more importantly, after this, we can add appropriate material to Wikipedia since the licenses match. This is an example of an article which has been published on WikiJournal of Medicine. The text can be used to expand Wikipedia articles. This is an image that has been submitted along with an article. You can see that it has been used to enrich the Wikipedia article on the topic. We can also review existing Wikipedia articles on this platform. So what happens is users who have written Wikipedia articles, they can submit it for review. Ultimately, it will undergo the peer review process, and ultimately the article undergoes betterment. At the same time, the authors get recognition for their work. And the benefit, as I mentioned, Wikipedia is the 7th most visited web page in the internet. So whatever work a person submits here, if it gets integrated into Wikipedia, or if it is under the same banner head, naturally it reaches a wider audience. So authors get certification for having undergone peer review and can be cited in scholarly publications in a standardized reference format. This is an example of open peer review. It's a bit hazy from your point, but you can go and check whatever comments the reviewer has left and how the users have responded, how they have upgraded the article, and so on. The editorial board consists at the moment of 14 persons. Some of them are medical doctors, some PhDs, and there's also a medical student there. So this is the board as of now. James was there, but once he joined the Wikimedia board, he had to leave.
For a few months I was there as associate editor, but somehow my name was vanished.
No, actually, to comply with the standards of certain bodies, we had to request associate editors to provide their details, which you had not done existing,
Probably
depending on the
I have
existing
not seen
standards.
probably.
So the standards were updated. You can still apply. So
Okay. No, I wanted to make it for few months to see what is there. Then I would have applied for board member. That was my aim.
great.
So directly jumping to board member, I don't think it will be easier. Huh? You go
We
from
can
the
talk.
grassroots level, not directly to the top. Okay.
Okay. Now, from your point of view, there's a lot you can do. You can publish articles.
Okay, forget.
You can help in peer reviewing. Even you can help with peer review coordination, which is a huge task for us. In short, it's reaching out to the potential peer reviewers and asking them to review. You can help in preparing the submitted articles. For example, if a person submits in non-wiki format, it has to be manually converted to the wiki format, and there are other tasks like that. Editorial board is definitely an option, and as I mentioned, we are looking for volunteers to help in peer reviewing. Finding peer reviewers. Now the impact, reach, and coverage. This is the altmetrics data for WikiJournal of Medicine. In fact, for the WikiJournal publishing group, but as of now, data for WikiJournal of Science has not come in. So, as you can see, there are 166 mentions. Among them, news mentions are 43, blog mentions 15, Twitter mentions 33, Facebook mentions 22, and Wikimedia mentions 53. So ultimately, the journal is gaining attention. This is the citation matrix of the journal. This is the impact factor as from Google Scholar, and as we can see, most of the journal articles have been cited often a number of times. The medical gallery of Michael Hagstrom in 2014 that has been cited 20 times, and so on. And furthermore, this journal has helped us, the editorial board members, to coordinate among ourselves and come up with a number of articles outside Wiki. For example, this is a journal article, Evolution of Wikipedia's Medical Content, Past, Present and Future. It has been published in Epidemiology, this was the JCH article. And James was a part of it, I was a part of it as well. So this has been one of the most read articles. So it is making impact. We have other articles like in Lancet Global Health. This is the WikiJournal of Medicine, the first Wikipedia integrated academic journal. This is the editorial in WikiJournal itself. An article in Stat. This is an interview published by ResearchGate. Another article on Stat. This is from Conversation. This is a conference presentation that I made, WikiJournal, a new form of open access publication. The other board members were with me. This is a article in Science. In fact, it was a letter. Academics can help shape Wikipedia. This is a Signpost article, Wikiversity Journal, as it was called at that point of time, a new user group. Another article from the Conversation, which James was a part of. And so gradually we are trying to take the impact to the academic community and trying to involve them for the betterment of Wikipedia. There are other WikiJournals that have come in, as I have already mentioned, with WikiJournal of Medicine as the premier one, primer one, the flagship one. So it is the first journal of the category and forms the prototype for open access peer-reviewed journals in other segments such as WikiJournal of Science and WikiJournal of Humanities. It's mediated by the WikiJournal Council. This is a snapshot of the council that we have. These are the members. This is the WikiJournal user group, which overall coordinates the process. These are the journals, and we have a preprint server. There's a French humanities journal Scientific Libre, which is proposed but not yet finalized. So this is a snapshot of WikiJournal of Science. The first issue has come out recently. The first issue for WikiJournal of Humanities is yet to come out, but is in process. So in summary, WikiJournals are a radical open access academic journals. They can encourage new contributors to provide content that can be integrated into Wikipedia, and they provide a mechanism for existing Wikipedia content to be reviewed by outside experts. So thank you. Any questions?
I have one question. The basic principle of Wikipedia is you provide the primary source information, not primary, secondary or tertiary, but this is a primary source information. So how can you take it in Wikipedia?
Wikiversity. It's a different.
That is my
what
question.
he's telling is,
Wikipedia.
how can we integrate primary source information into Wikipedia? And he's right. I have not detailed the entire thing out here. Original research is not to be copied onto Wikipedia, but we have review articles, and even in case of primary source articles, which where original research is published, there's some review material which is there in the articles. Those things can be directly copied into, but whatever is original research, as I mentioned, here it differs from the Wikipedia platform, so those things cannot be copied outright into.
Except, of course, the pictures, right? So
I was thinking about.
we allow
This is a primary source.
Furthermore,
but you know, we of course allow primary research pictures. So you know, if you have a microscope slide that you've created yourself, you can publish it in WikiJournal of Medicine, and then you have that extra level of
This is a primary source Wikipedia.
Yeah, yeah.
Furthermore, I have not mentioned that there are licensing differences for original research and for others. I'm not going into the technicalities, but yes, there are differences.
How many articles have been published so far?
It's slightly less than 40 as of now.
So, does this also not provide a place where you can, especially for the review articles, where the board of the journal can go out and say we would like someone to do a review article on a certain subject that's missing or incomplete on Wikipedia, and then so it becomes.
Absolutely.
And just to get it clear, any article in the WikiJournal can be referenced straight on Wikipedia?
As of now, there might be issues with notability. I don't think it's non-notable, but I'll leave it upon the community to judge. In case the community does not judge it to be notable, they might not like to reference it. But yes, it can be directly integrated and also referenced.
Okay, thank you.
There's another. Yeah.
John, do you want to come start setting up?
Sure.
Okay. Is there any major challenges that you face in WikiJournal?
Yes, we have faced a number of challenges. The most important challenge that we are facing is to find peer reviewers. As of now, our journal is not very recognized. It is somehow recognized and is gaining recognition, but any academic journal, it takes time for the recognition of a journal, something like a 5 years span. So in this period, reviewers are skeptical that whether their work would gain recognition or not. So it's hard to find reviewers for the journal. This is the primary hassle that we have faced, number one. Number two is while trying to draw users to submit, they seek recognition of their work. For example, we are yet to break the 40 article mark. So prior to that, our journal is not PubMed indexed. So many people do not wish to publish before it is indexed. So these are practical problems. Yeah.
Yes, when something is started new, always there is skeptical views. No problem. Anything in the world.
As of now, we have already become DOHA recognized, and there are standards that we have maintained, which have made us go into COPE membership and ICMJE recognition. So these are things we have managed, but it's step by step. There are other standards we like to achieve. For example, if we can make into the Web of Science, which we hope we can very soon, we can gain recognition in a large number of academic databases, which recognize journals where publication gives recognition to people. Since we are not recognized as of now, it's a hurdle for us.
Let's, so since we're low on time, let's continue the conversation at lunch, and let's have John begin his presentation. Thank you.